Good afternoon, and welcome to this local Blackhawk County Emergency Management and Emergency Operations Center COVID-19 press briefing for this Thursday afternoon. This press briefing is being offered today to our media partners via Zoom, as well as Facebook Live. This is an attempt to encourage social distancing, improve our communications and our outreach, as well as better keep our media partners safe during the COVID-19 outbreak. For media partners who are joining us by Zoom, you've already been muted. As you entered the meeting, you'll have the opportunity to ask questions. You can do so after the speakers have spoken. We ask that you either raise your hand by hitting that button or put your questions in the chat box. If you're using a telephone, you can hit *9 to ask that question and raise your hand, and they will unmute you. We have moderators here to help facilitate that for you. We will try to address all questions that are asked. However, if you ask a late question, we will make sure that it gets routed to the right person so that it can be asked and answered in a timely fashion and getting back to you in a timely fashion as well. Today's press conference is it's an exciting one because it's kind of a make good from an earlier effort to get some of the representation from what I think makes Blackhawk County great. We are the most diverse county in Iowa by population, and today's representation is of that makes Blackhawk County great, that diversity, and we have great representation and representatives of that diversity here with us today. So without further ado, it is my pleasure to introduce some of that diversity with our incident commander and our director of public health here in Blackhawk County, Dr. Nafissa Cisse-Egbounye.
Good afternoon. I will begin with the data today. As of Thursday at 12:30, there is a total of 1,877 reported cases in Blackhawk County, and we have a total of 37 deaths. We have a total of 1,136 people who have recovered, and we have a total of 7,750 who have tested. We currently have 4 long-term care outbreaks: Pillar, New Aldea, Harmony House, and Friendship Village, and we are monitoring 2 other facilities. Governor Reynolds issued a proclamation for additional openings yesterday, so effective at 5 a.m. on May 22nd and until 11:59 p.m. on May 27th. Movie theaters, any theater at which motion pictures are shown may reopen, but only to the extent that the theater complies with the following requirements. The theater must limit the number of patrons present in any individual theater to 50% of its normal operating capacity to ensure adequate spacing of groups and social distancing. Museums, aquariums, and zoos are to remain open. Summer school activities may reopen for school-sponsored activities and learning activities effective June 1st, 2020, and school activities should hold no more than 10 people in terms of gatherings. Swimming pool also may reopen for limited purposes of lap swimming and conducting swimming lessons. Also, Governor Reynolds announced that next Thursday, May 28th, bars and other alcohol-related establishments that have been limited to carry out and delivery will be permitted to reopen for indoor or outdoor seating. These establishments will follow the same public health measures that restaurants have been implementing for the past couple of weeks. So as we continue to reopen our establishments, I urge the community to continue to practice social distancing, wearing a cloth face mask, and frequently washing your hands for at least 20 seconds, and disinfect frequently touched surfaces. To the business community, please, again, take your time to reopen safely for your own health, your employees' health, and the community's health. We appreciate the calls we have received from business owners who are doing their best to implement safety measures. Businesses, please feel free to call the health department. We are here to help you implement these safety measures. We will continue to post guidelines and social media images for preventative measures. So please visit blackhawkcovid19.com or our Facebook page for more information. And at the health department and here at the EOC, we really appreciate all those who call to express their concerns or gratitude. The goal of the health department is to ensure the health of our residents where they live, work, and play. And I know that this new normal is difficult for all of us, but let's continue to be hopeful and safe. And thank you all for implementing these preventative measures.
While we are in the vein of saying thanks, we also want to recognize those employees at the long-term care facilities, both in outbreak status, monitoring status, as well as those that are out there on the front lines every single day. I can't imagine what that feels like to go every day knowing that you're walking into the lion's den. The amount of work and effort that they have put in to help stem the tide, to help fight it in their hallways, to do the work that they are doing with 4 in outbreak status, 2 more that are currently being monitored, 1 more that is concerning to us that may go into outbreak status. The amount of effort that has gone into those facilities, again, with the staffing concerns that they already have, we are deeply, deeply appreciative of all of the CNAs, LPNs, RNs, nurse practitioners, and all of the long-term care facility working staff that are engaged in our frontline defenses right now. We certainly want to continue to encourage people to do what they do, both in that vein as well as in your own public safety and personal safety vein to help you, your family, because everything you do helps stem that spread for all of those folks that are trying to fight this battle on those front lines as well. Now, without further ado, it is my pleasure to introduce to you Moriah Morgan. She is the REACH Advocate Programmer here and the Waterloo Office Manager. Morgan?
Hey, yes, thank you for having us on today. I'm glad to be here with everybody. We're happy to talk about some of the different initiatives that Embark is currently doing with the community in Waterloo and some of the different projects. Specifically excited about the work that we've been doing with Black Hawk County Health Department and the work that is with launching our overnight helpline, which is going to be able to help a lot of the community in accessing and speaking to their primary care providers across Waterloo, as well as a lot of the case management and direct services we're doing with our statewide helpline and being able to provide that currently in 10 languages. And then for our overnight helpline, being able to kind of broaden that with the assistance of the health department to serve a lot of the different refugee communities and immigrant communities in Waterloo that we have not traditionally been able to serve. So expanding that to right now also assist with the Spanish-speaking, Bosnian-speaking, and Marshallese-speaking communities in addition to Burmese dialects and African dialects. I'm happy to turn it over to my coworkers to talk a little bit more specifically about why we are doing some of those services and kind of some of the needs that they have been seeing in the community.
Thank you, Moriah. Abigail, you next?
Yeah.
All right, Abigail Sue.
Thank you for having us. And again, my name is Abigail and Parent Navigator Program Manager with Embark. The majority of our community members are workers at the packing plants or have family members working. Situations are changing really quickly. And right now we are seeing many of them testing positive. Our recent data shows that more than 70% of the Burmese community members who work are testing positive. Workplaces have opened and many of our community members are sick and cannot go back to work. Embark is trying to directly help the community during this time with filing for unemployment, asking for sick leave, and other needs. Families that are self-isolated in their homes need for food delivery, not a phone number to the food pantry. They need food delivered to their door, and we are doing that. We also act as a bridge to parents with school-age children. Many of families do not have computer and access to internet or not know how to use computer or technology. So we need assistance to accommodate immigrant and refugee communities so they can properly help the kids learn at home. Yeah, thank you. And my coworker Julie can take over.
Julie Molisho.
Oh,
Hello,
hello.
Julie. Thank you.
So I am Julie, and I work for Embark as a rich advocate. So I am from Congo, and I want to talk about some challenges that we faced as a community, immigrant community, with the pandemic. So as a community from Africa, coming here, it's already a big challenge. We have to face the weather, we have to face the languages, we have to face the American culture, but on top of all of that, the pandemic came to add some more challenges on our plate. So like all the culture, like everybody, it was a big challenge for us because it asked us the change of behavior. Those behavior define us. Like I can say in Africa, we live like a family. Like social distancing was a big challenge for us. Like wearing those masks was a big challenge for us. But we overcome that by the help of the health department and the Embark. They were helping us to give us information that we need to change our behavior. So that's how we help our community. I was through the Embark, like a bridge between the community and the society, trying to help them how to follow the rules, how to adjust themselves to the new pandemic. Also, I was helping them when they were sick. Usually they were calling me to tell me that they were sick, what to do. Since I had all the information, important information, I direct them I can call Mercy One, telling them so person, this is his case, and they were helping me you have to send him to the emergency room, or he can stay home, he can self-quarantine himself. So that's what we did, and I want to say thank you to the health department for helping us. Thank you.
Folks, on behalf of the Health Department, the Emergency Operations Center here in Blackhawk County, and the citizens of Blackhawk County, your services during a time of pandemic have been greatly appreciated. We thank you so very, very much. And Moriah, I apologize by calling you by your last name. You look like a Morgan to me anyway. So, no, it was definitely services that are necessary, that are needed, and the advocacy, not just the interpretation and those kinds of services, but the advocacy is something that we greatly, greatly appreciate. So thank you for the work that you do and the efforts that you have put forth during these challenging times as well. Folks, without any further speaking, we open ourselves up to your questions.
We have a question from CBS Evening News. They wanted to check if there's an update regarding the Tyson plant in Waterloo and COVID-19 infection cases.
So in terms of Tyson, at this moment, we haven't heard any new complaints. And I believe that Sheriff Thompson also met with Tyson Corporate this week, right? This week, yes. So I will let him speak on that. But we have not had any complaints that I am aware of.
As everyone knows, that they did hire a medical company to do on-site testing, on-site referrals, and systemic review for their facilities. And that sounds to me like is working very, very well. I did have the opportunity to meet with Noel White, the CEO of Tyson, as well as the Senior Vice President, Troy Neff, earlier this week with the Mayor of Waterloo. And that meeting went very, very well. They expressed their interests in our efforts. They expressed their desires to continue to work cooperatively with us. And they expressed some goals that they would like to do moving forward. They did take lessons learned and expressed a desire to go back in time, and if they could do some things differently, they would. So it was good to hear. It was a good dialogue, and it continues to forge good partnerships moving forward. We expressed to them that, again, this was never an us versus Tyson thing. It could have been any company, any plant, any kind of facility that was presenting such a detrimental opportunity to expose our citizens, and it happened to be the meatpacking industry and Tyson that was doing so. So we did have a good meeting with regard to Tuesday's afternoon meeting. The hope is that Tyson continues to do the vigilant efforts that they are demonstrating now, and that they continue to work cooperatively with the Department of Health and with all other regulatory and observatory opportunities that exist to make sure that we continue to have solid defenses there as we move forward.
Tony, do you think that the governor is right in reopening on the timeline that she is reopening regarding businesses in terms of testing?
So the question is, do I think that the governor is right on the timeline that she is using to reopen? I will answer that on a personal level, then I will answer that on a holistic level. Personally, I don't think it's right. I think it's a concern only because we're already seeing, I think overnight we saw 402 additional cases across the state of Iowa, which was a considerable spike from the previous few days. So there is some concern, and we've kind of expressed all along that as we start to lessen restrictions, as we start to have more freedom of movement, as we have the opportunities to interact more freely, that we have to take those freedoms seriously. We have to take that obligation more seriously. And frankly, there is a lot of indication that maybe that's not being taken to heart. So it's not my goal to regulate the community any more fervently than is already being regulated, but I certainly don't want to further victimize anyone either. So from an emergency operations standpoint, one of the things that I expressed today at 1 o'clock during our planning meeting is we don't have control over any of those kinds of things. That is not within our purview. Our control is merely to be able to express to the citizens of Black Hawk County what control measures are out there, what the rules are, and to express our hope and our concern that they continue to follow those best practices and those guidelines that we can lay out so that they can better protect themselves and their families. We continue to express those guidelines. We continue to express those best practices in every way, shape, and form possible to try and encourage the stemming of the growth of the spread of the virus here in Black Hawk County to any degree possible, because we're all kind of on that same roller coaster ride right now. And it doesn't seem that regardless of anything that we do, we're going to be able to stop the ride. But if we can slow the ride, if we can slow those peaks and valleys just a little bit, that will be in our best interests at this point.
We have a question from Caroline Cummings from KGAN. Caroline, you've been unmuted.
Hi, my question is about if you've heard anything about the Waterloo Test Iowa site closing next week. I know on the website, your site in Waterloo as well as one in Woodbury County don't have appointments or times scheduled through next week. And if that's true, are you concerned about that closing now that the governor is allowing anyone who wants to get a test to be able to get one through Test Iowa?
You have picked up on something that is in fact happening. It's happening, I believe, on Friday afternoon. They are shutting down the Waterloo Test Iowa site, and they are moving it to Marshall County. The Woodbury site is also closing, and they are moving that to Sioux County. I don't know the rubric behind or the methodology behind why those sites are being moved, particularly in a time when they are opening up the criteria for what and who can be tested and why or how they can be tested. It doesn't make sense to me that way, but the fact of the matter is those sites are being moved. Again, our site is being moved to Marshall County, and the Woodbury site is being moved to Sioux County. So I do have concerns regarding that, but that was a decision that was made at the governor's level, and we simply react and respond to those decisions.
We have a question from Iowa Public Radio, Kate Payne. Kate, you have been unmuted.
Thanks. So a follow-up on the Test Iowa situation. We've seen some concerns in Lynn County about those officials not getting data quickly, not knowing how many tests are conducted, not getting the results when they come in, and not being able to do contact tracing on those results. Is Blackhawk County having similar issues, and do you all feel that you're getting the information you need from Test Iowa?
So Test Iowa has been a bit of a quagmire for, I think, everyone. And there's a lot of reporting being done about the numbers, about the quality of the testing, about the amount of data being released out of the Test Iowa sites. All of that is an experience that's being shared by every Test Iowa site. So I think I will leave my response to about that same generality. Our experience has been no different than Lynn County's experience. That's been no different than Polk County's experience with regard to the timeliness of response, the timeliness of test results, the ability to dig deeper into the data. There's just been a lot of dysfunction associated with the Test Iowa results, and unfortunately, that's something at the state level that's being very managed and controlled by the governor and the governor's staff.
Can you talk a little bit more about the Waterloo site being moved? Will Blackhawk County residents be able to go to that site in Marshall County or other similar sites? So
any Test Iowa site, if you went on Test Iowa today, you could get an appointment in Des Moines if that was most convenient for you. So it doesn't change much other than the drive. So people from Lynn County were able to come up to Waterloo and get a test appointment here. Even before their Lynn County site opened. So that would be the same for us. Anybody here would be able to drive to Marshall County to get a test, yes.
When did you hear that they were moving the site?
Earlier this week.
And you said that it was this Friday that they'll be moving it?
Correct.
We have a question from Iowa Public Radio, Kate Payne. Kate, you've been unmuted.
Thanks. Do you have an estimated turnaround time for how many days it takes for the county to get the results once the Test Iowa test is conducted?
We don't have anything even remotely close to a guess regarding that at this point.
We have another question from Caroline Cummings from KGAN. Caroline, you've been unmuted.
Hi, yeah, just to tag on to Kate Payne there again. I know, I guess it was last week, 1 week ago from today, that you guys said that you hadn't received any Test Iowa results from the Waterloo site. So that would have been, I think, about 2 weeks from its opening, if I'm remembering correctly. So can you just, in the best way you know how, explain when you guys received those, how many results you received when you finally did get them, and are you still pending results right now?
So I'll tell you very honestly, the issue with Test Iowa is there's no local issue, control, intervention, involvement. So when it comes to Test Iowa, my recommendation would be that you ask those questions directly of the governor or of the governor's staff. And that, quite frankly, and again, quite transparently, quite honestly, is part of the problem. So the questions that you're keying in on are questions and issues that we have been dealing with all throughout the Test Iowa rollout. But while it's frustrating that Test Iowa is leaving Waterloo for the convenience, I can tell you very frankly, from an emergency operations perspective and from a law enforcement perspective, providing law enforcement supports out there, I'm not sad to see it go from Blackhawk County.
I have a question for Nafissa. Abigail mentioned briefly that she believes that about 70% of the Burmese are testing positive. Can you speak to this at all?
Yeah, that's a good question. And I think maybe perhaps because Abigail's from the community, she has a good sense. I mean, for us, in terms of our reporting, we can't really zoom in to that. But if you look at our data, in Blackhawk County right now, about 18% of the Asian population, in regards to our cases, have been impacted by COVID-19. But I can't confirm the 70%.
Oh, sorry. We have a question from Kate Payne, Iowa Public Radio. Go ahead, Kate. You've been unmuted.
Thanks. Dr. Egbounye, could you give us an update on how many total cases have been linked to Tyson?
No, we don't have an updated number.
Okay, so still that 1,100-ish number from a couple weeks ago?
Yes.
I had wanted to know about how many daily average tests there were, excluding the Test Iowa site.
From our data, we don't have daily. Go ahead.
Hello again, everyone. Joshua Pecora, Blackhawk County Health Department Disease Surveillance and Investigation Manager. So in regards to testing numbers, so I just want to explain a little bit how our disease surveillance system works. And what we're able to see on the public health side is the number of reports that are entered into the surveillance system. So when a positive test comes into surveillance system, it generates an alert, a case, and we see that case. From the testing perspective, positive and negative results get entered into the surveillance system. So we're able to get at the local level some semblance of the number of tests, but it's driven by those results coming in. It's not driven by the tests being collected. It's the healthcare providers, the clinics that are able to provide the number of tests that they ran, the number of patients that they saw each day. And even from our local perspective, when we're looking for test results, if an individual has multiple negatives, they get added together onto that individual's case. So it's very difficult for us from the surveillance system to see the number of tests. That's the number that's really driven at the hospital and clinic level.
We have another question from Kate Payne, Iowa Public Radio. Kate, you've been unmuted. Oh, must be lost her.
Okay, I think you can hear me now.
Yep.
So one of the concerns that we've heard as the state reopens is that it could be harder for contact tracers to determine how an individual was infected, and that a spike in cases at a particular business or facility could go undetected longer. Is that a fair concern?
This is Dr. Egbounye. There's a lot of fair concerns as the state reopen. I think that's one of the, if to directly answer your question, there's so many concerns. In regards to contact tracing, the health department, we do our best to ensure that we're collecting the necessary information to do the best job we can possible. But there's so many concerns in terms of reopening, in terms of the resurgence of COVID-19. And so that's why, for me, my message is going to be consistent in that those preventative measures are critical. And it's so important for people to know that COVID-19, again, is here. It's not because we're reopening businesses that it's not here. It's here. We have to be able to wear our face covering, social distancing. I mean, this is our new normal. As difficult it is, this right now is our new normal until we get a vaccine or treatment for it. this is the best way to prevent us from getting sick from COVID-19 and also protect the vulnerable populations. When you look at our data, you see that the majority of the deaths have occurred among people 61 and over. So it really has a great impact on the elderly population. So it is our responsibility to ensure that we're implementing these safety measures so that at least we can protect the vulnerable populations.
And we have a question from Carolyn Cummings from KGAN. Carolyn, you've been unmuted.
Hi, thank you again. Can you hear me? I don't know if you can hear me.
Yes, we can hear you.
It's working. Okay, sorry. This is my first time participating in a Zoom meeting this way. Just to tag on related to contact tracing, can you talk about what, if any, issues it causes when you're getting delayed results in doing that contact tracing job effectively?
I mean, it does cause issues, but one of the things that we've also been communicating is that anybody with respiratory illness symptoms should stay at home and self-isolate. So if people are also following the communications and the preventative information that we put out there, I think also it's the responsibility of also the individual to play a role in protecting the community and those that they are in contact with. But from a state level, in terms of our workflow, it does create some barriers because we're waiting for the results, and so which means that it can be a delay in communication with that individual. And so my hope is that the state health department is doing their part in communicating the results as fast as they receive them to us.
And we have a question from Iowa Public Radio. Kate Payne, you've been unmuted.
Thank you. So again, on the contact tracing, Dr. Egbounye, do you have plans to beef up staffing or change the way that you all are handling contact tracing as this gets more complicated as we reopen?
Well, first, I think my staff we have an excellent team. They go above and beyond the call of duty. When we had the increased volume for Tyson, we had staff working Monday through Sunday. So I admire, I trust my team. I know that they will always put their best foot forward. So for me, it's a matter of just what we can do to control the spread of COVID-19 and prepare for it if there's a resurgence. But in terms of contact tracing right now, the State Department is assisting us with that. And that's also part of, I believe, their responsibility, because we here at the local level, we have also other operational needs that are occurring. We have people that we provide treatment for other infectious diseases outside of COVID-19. And so I am appreciative that also the State Health Department has taken that role to assist the local health departments in terms of contact tracing.
And she has a follow-up question. Go ahead, Kate.
And Dr. Egbounye, have you been satisfied with the state's contact tracing? I mean, we've seen them sort of falling down with the testing issue. Are they meeting your needs with contact tracing?
I believe so. At the state health, for us locally, we work with specific divisions within the state, and I have direct communication. They communicate with me via text, via phone. So at the moment, we have not had any issues in terms of just the communication of for contact tracing. I do believe that they've always had an open door communication with us and vice versa, and we'll continue to do the best we can to serve the community.
With the Waterloo test Iowa site coming offline, have you been in contact with the hospitals at all, whether they're able to sort of provide more tests in the way that the governor said she was opening up testing to everyone?
We have. In fact, the hospitals have requested additional test kits to be able to supplant some of that. What we discussed today at the 1 o'clock planning meeting was ensuring, now there has been a change with the state hygienic lab, that we were ordering those test kits out of the EOC, and that no longer is required. So now those clinics, People's Clinic, the Fury Clinic, the Mercy ones, the Unity Points, they can go direct to the state hygienic lab now. So they've streamlined that process and made it less bureaucratic. So they can order their testing kits and supplies directly from the state hygienic lab. So it should make that process a little more streamlined for them. But we've directly addressed some of those concerns and tried to anticipate. Again, when you're trying to supply and logistically support those frontline foot soldiers, you've got to be one step ahead of them, and that was one of the discussions that we had today as well.
How was our PPE supply countywide?
Good. We did request and received a few more supplies yet today. But those were specifically addressing some needs addressed in long-term care facilities in outbreak status. So those were received, but those will go out almost immediately. So we're in good shape. I was green across the board for all of those needs.
We have a question from Kate Payne from Iowa Public Radio. Kate, you've been unmuted.
Thank you. I wanted to ask to the advocates, Abigail and Julie, have you been hearing more complaints from workers since Tyson has reopened? And do you know if people are going to work sick, for instance?
Abigail, you've been unmuted.
Yeah, we receive a lot of phone call asking, not knowing how to, what to do. For example, should I stay home or should I go to work? So it is hard for us to tell them or making a decision for them because even though they know that they are testing positive, but the worker, the company need them, so they are in between having a hard time either to stay home or to go to work. So yes, we receive a lot of phone calls and asking those questions. And in Waterloo is a little bit different than Des Moines because Waterloo is experiencing similar thing. They have more asking for request sick leave and then disability application. In Des Moines, we have more unemployment pressure. So in Waterloo, there are more people sick, and then they're asking for if they can extend their extent of leave. So that's a little bit different between Waterloo and Des Moines, our community members.
And Julie, did you have anything you wanted to add?
Yes. In my side, like we said, most of our community work for the meat packing here, but some of them
Julie, we've lost your audio. I'm not sure why. I don't think she can hear us.
Okay.
Okay. All right. And Moriah, did you have anything to add?
Unfortunately, I can't read Julie's mind to figure out what she was trying to say. But we definitely, there's a lot of fear going on right now, which obviously everyone across the state of Iowa and across the world right now is afraid. And there are a lot of questions, and there are factors for a lot of the community that are impacting the choices that they have to make, and it becomes a really difficult question for them to make. So, and agreeing with Abigail, it's sometimes they're wanting to know what's the proper choice to make, and with guidelines changing, that is something we're trying to support by increasing communication and education throughout the community. So Embark produces daily videos in 10 separate minority languages, and those type of videos are help give some updates on the different recommendations coming out by the CDC and local health departments in the policies and procedures based around going back to work to try and decrease some of that fear that's happening in the community. So those have been helpful, but we definitely do still get a lot of calls.
All right. Thank you again, Moriah. Thank you, Abigail, and thank you, Julie, for joining us today. If there are no further questions, that will conclude our press conference for today. I will reiterate that Monday being a holiday, we will not have a Make Good press conference on Tuesday. We will opt to have a press conference on Thursday, and beginning that Thursday, we will start reducing our press conferences to once weekly. So every Thursday from this point forward, we will be having one press conference per week, beginning with next week's Thursday press conference. At this point in time, we are still negotiating with our incident commander as to who we will have on that lineup, whether it's our medical staff again, or healthcare staff, or Department of Health staff. We're still Indian leg wrestling trying to figure that out. So we'll let you know as soon as we know the lineup for Thursday's press conference, but that will be the way it rolls from this point forward. Thank you very much, folks. I appreciate your attendance. Have a great weekend.